I looked over Larry's chart.
So what do you think? We should really keep Larry on his metformin, but what other medications would also be appropriate to prescribe for him at this point?
These choices are the same ones we've considered throughout this simulation. Since Larry's A1C is not at goal, we need to evaluate which medications will work best to get that under control, and may also provide other benefits for him. I see 3 options here that could be appropriate for Larry.
Are you ready? Let's use this first A-orb to choose the regimen that you prefer. Well, DPP-4 inhibitors will help reduce Larry's A1C.
Yes, they will, but they're not an optimal choice for Larry. We need to consider Larry's cardiovascular risk. A DPP-4 inhibitor will not reduce the risk of cardiovascular disease.
All right, let's look for another option. Larry has peripheral vascular disease, so is an SGLT2 inhibitor a reasonable choice? They can increase the risk for PVD.
Keep in mind that Larry just had a femoral popliteal bypass, which significantly reduced his risk of peripheral vascular disease complications. So we could use an SGLT2 inhibitor for him.
But in one clinical trial, there was actually an increased risk of lower limb amputation in patients with PVD who took canagliflozin.
The Credence trial looked at canagliflozin, and there were no significant differences in rates of amputation or fracture. We can't really call out one drug over another as riskier based on current evidence.
SGLT2s do provide a protective effect for cardiovascular disease.
Yes, and that would definitely be beneficial for Larry.
A GLP-1RA would provide cardiovascular protection for Larry, so I'm with you on this.